Hi, my name is Laura and I'm a nursing student, and today I will be demonstrating how to push a medication through an IV. Now, I will be doing this while using my general principles and safety practices, and I will also be implementing the 11 rights of medication administration and using those 3 safety checks while doing so. Now, first I'm going to verify that order. I'm going to verify that that patient is getting that specific medication, and I'm going to make sure that it's the correct dosage and everything is appropriate. I'm going to know if there are any adverse reactions or any complications with that medication, which goes back to our 11 rights. Now, I'm going to see that that patient is already getting an IV currently, and I'm going to also make sure that there is a compatibility with that IV, and if not, I'm going to take precautions. So I'm also going to get into the patient's chart, and I'm going to see if there are any allergies that the patient might have. If the patient may have any allergies to medication, and I'm also going to double check to see if that patient may have any food allergies, allergies to any skin antiseptics or latex or tape adhesions. So I'm going to gather my supplies, and part of gathering the supplies is gathering that medication. Now, depending on what facility you're at will depend on how that medication will come. It may already come in a syringe ready for you to administer, or you might have to draw it up in a vial. It just depends on where you're at. But at this time, I am also going to do my calculations, because depending on what medication it is depends on the rate in which you're going to push that medication into that IV. So, and I will also be starting my 3 safety checks at this time, like I previously stated. So we're going to take our equipment and our supplies, and we're going to go see our patient. Now, as we go see our patient, we are going to perform hand hygiene and put on any kind of PPE that is required. Now we're going to go in and we're going to identify our patient using our 2 patient identifier, and we're also going to check and see if they have an allergy bracelet on. And we are going to also verbally ask the patient about their allergies. So I'm also going to, depending on the medication that I will be administering to that patient, I am also going to do an assessment of the patient at this time. I'm going to do a small focal assessment before we go any further. So now at this point, I'm going to ask the patient, have you ever had this medication before? Did you have any reactions to this medication before? Do you have any questions about this medication? Is it okay if I proceed in giving you this medication? You know, I'm just going to open the floor up to conversation, to any questions that the patient may have. So, for video purposes, this is going to be the arm of the patient, and I already have everything ready to demonstrate how to give a medication push into a patient. So next, what I will do is I will do my hand hygiene again, and I will put on gloves. Now, what we also want to do is we also want to take a look at that site of that venipuncture. And that should be part of the assessment. We want to look at it, we want to palpate, we want to see if there's any type of irritation Okay, any type of irritation, any type of redness, any type of swelling, anything that's abnormal that shouldn't be there. Okay. Now, after we do that, we want to, like I said previously, the patient is already on an IV solution. And for this video, the patient is not on an IV pump. The patient is on an IV with gravity at a gravity drip rate. So what we need to do is we need to close the clamp. Okay. So the clamp is closed. It has stopped the flow of the IV in the tubing. And I am going to unhook and I'm going to hang it right up here. Okay. And what I want to do first is I want to get an antiseptic pad and I want to scrub that hub. Okay. And I want to allow it to dry. And first, I need to flush. So I'm going to grab my saline. After it has dried, I'm going to attach it and I'm going to aspirate the syringe. So I'm going to pull back until I see blood in my J-loop. I have a good blood return. And then I'm going to insert about 3 to 5 milliliters of saline into the J-loop. And then I'm going to take my antiseptic wipe and I'm going to scrub the hub again. But this time, I'm going to take my medication, take the cap off, scrub the hub, allow it to dry. Now, like I said previously, depending on the medication depends on how long you insert the medication into your J-loop. So that's different for every medication. So it has dried, so I will attach now. So say it takes 1 minute as an example. So I'm going to stand here and I'm going to push the medication into the IV and I'm going to time it with my second hand on my watch for 1 minute. And when that minute's over, I'm going to put it down and I'm going to scrub the hub again, allow it to dry. And then I'm going to take my other saline, attach, and this time with my second flush, I am going to flush the second saline into the J-loop at the same rate as I did my medication. And in our example, I said it was 1 minute for the medication, so it's going to be 1 minute for the second flush of saline. So I'll stand here and time it at 1 minute with my second hand and push very, very slowly for 1 minute. 1 minute's over. Put that down. Scrub the hub with my antiseptic wipe. Allow to dry. And then come over here and I will take my IV and I'm going to scrub that hub as well, allow to dry, and I will reattach. Okay. Now, whenever I was putting the medication back, or whenever I was putting the medication into the IV site, I was looking at the patient's skin. I was seeing if there was an immediate reaction that I could see at the point of the venipuncture. And with this patient, I did not see anything, but that's very important. Now I have reattached the patient back up to their IV. So what I'm going to do is I'm going to take the clamp, since this IV has a drip rate by gravity, and I'm going to slowly unclamp the IV, and I am going to set it back to its original drip rate before we started the IV medication push. And I'm going to watch that drip right there. And once I have that set and the patient is good to go with their IV, and I'm going to ask the patient how they feel, how they're doing, and I'm going to take off my gloves, and I'm going to come back and I'm going to check on my patient, and that'll be in about 15 to 20 minutes because it was a medication. And I'm going to clean up my area, and I will put everything in its appropriate container. So I'll just put a glove on again. Clean up my area, and I'll go and I'll document. And like I said, I'll be back in about 20 to 30 minutes, 15, 20 minutes to check on my patients, see how they're doing. Thanks for watching. Bye.